going to see the classification or staging of the colorectal cancer. So we have the TNM system. T is for tumor size, N of lymph nodes, lymph node involvement, M metastasis. So the tumor size would be divided into TX, T6, T1, T2, T3, T4. T4 is further divided into A and B. The N would be divided as N, X, N, O, N1, that is further subdivided into A, B, and C. N2 divided into A and B, and the M is M0 or M1. M1 is divided into A and B and C. So the TX is the primary tumor cannot be assessed. T6 is the tumor is limited to the mucosa, is carcinoma in situ. T1, there is involvement of the submucosa. T2, the tumor involves the muscularis propria. T3 penetrates all the muscularis propria and invades the pericolorectal region without the peritoneum. And T4 is involvement of the peritoneum or adjacent structures. T4A is involvement of the peritoneum, and T4B is the involvement of adjacent structures. Then the classification of the regional lymph node involvement. NX is cannot be assessed. NO is no regional lymph node involvement or metastasis. N1 is metastasis from 1 to 3 regional lymph nodes. N1A would be 1 regional lymph node is involved. 1B would be between 2 and 3 regional lymph nodes. And 1C is no lymph node involvement, but involvement of the adjacent soft tissue. N2 is the involvement of greater than or equal to 4 lymph nodes. Between 4 and 6 would be N2A, and greater than or equal to 7 would be N2B. And metastasis. MO is no metastasis. M1 is metastasis to distal sites or structures of peritoneum. 1A is distant metastasis to one site or organ without peritoneum. M1B is 2 greater than or equal to 2 sites or organs without peritoneum involvement. And M1C is the involvement of the peritoneum. Could be with involvement of adjacent of other sites or organs, but the important issue is that there is the peritoneum involvement. So the tumor size can involve the peritoneum, that would be T4, but is adjacent peritoneum. When there is involvement of a distal peritoneum, that is the metastasis M1C. So tumor stage. TX, NX, whatever be, cannot be assessed. He's for tumor, he's for regional lymph node involvement. T6, carcinoma intramucosal in situ. T1, submucosa. T2, muscularis propria. T3, pericolic region perforating all the muscularis propria. T4A, peritoneum. T4B, adjacent structures. NX cannot be assessed. NO, no regional lymph node involvement. N1A, 1 regional lymph node. N1B, 2 or 3 regional lymph nodes. N3, no regional lymph node involvement, but adjacent soft tissue involvement. N2A, 4 to 6 regional lymph nodes, and 2B, greater than or equal to 7 regional lymph node involvement. MO, no metastasis. M1A, 1 metastasis to a site organ without the peritoneum involvement. M1B, distal metastasis to 2 or more sites or organs without peritoneum involvement. And M1C is metastasis to the distal peritoneum.